Honestly, I don't need noise canceling. It is very quiet here. All right, we good? Okay, so the olfactory nerve has to do with smelling. Look at this beautiful flower. Yeah, so you can smell things with your nose because you have your olfactory nerves. It carries the impulse or sense of smell. The origin is epithelium. I guess that's where it begins. And then you have the opening in the skull. That's the cribriform plate of the ethmoid bone, the bone receptor in the roof or nasal cavity, and it attaches to your cerebrum. So it talks about it can be caused bilateral anosmia, such as COVID, common cold, mucous membrane. You get lesions on it. You have the frontal lobe of the cerebral hemisphere, your olfactory bulb, your olfactory tract, cribriform plates, the ethmoid bone, filament, olfactory, and your nasal mucosa. This is a lot less bright on my screen, so it's kind of hard to see. Then you have your optic nerves. Optic is 2. I kind of want to make sure these are in order actually before even going any further, because that is a key component. You want to know, you can't just know the name of it. You have to know whether it's CN1, 2, 3, or 4. So let's see if these are correct and cross-reference. 1, 2, 3, 4, 5, 6, 7, 12. Ah, yes. Okay, so yeah, 1 is olfactory, 2 is optic. Just making sure. Trigeminal is 5. I thought it was 3, so I got that wrong on my test. Let's go back to this. I got sleep last night, but I'm so tired right now. This job is abusive. So optic factory is, think of nose, 1. You have 1 nose. That is your first nerve, is your olfactory nerve. Optic nerves, you got 2 eyes, that's 2. You've already memorized 2 of your cranial nerves right there. You don't have to worry about, maybe we'll come up with more mnemonics as we go further. Optic, yep, so it is the back of the ball, the retina of the eye, the opening in the skull, the optic canal, from where it converges to form the optic chiasm. It attaches to your diencephalon. Honestly, I don't even know what that is. I know your pons is deep in the back of your brain, so maybe that has to do, I feel like something around the words there, kind of a clue that tells you what that is. Reflexes generated by this nerve are light reflexes, bilateral, geniculate, body visual reflex, and corneal reflex by blinking the eyes. You have lesion leads to total blindness of one eye, and hemanopia, partial lesions of the optic chiasm on its lateral side. Here we go. So this is the bottom of the skull because you have the foramen magnum. This is where the brainstem comes out of. And then these would be the optic, what are these called? I can't remember. Visual cortex here to the optic tract and your retina, so everything's kind of like twisted upside down. I think I remember seeing that in a science book. The way you see things through a lens, it almost has to like correct it and twist it, because otherwise everything would look upside down. That's gonna kill me. What are those? I don't know. Where's my water? So you have your oculomotor nerve, 3. Still in the eyeballs. Honestly, the next 5 nerves are all going to have to do with the eyes. So we got to figure out a way to distinctively be able to tell the differences between those. All right, so function raises the upper eyelid, turns the eyeball upward, downward, medially, constricts the pupil, and accommodates your eye. I don't know what accommodate means. 2 later functions are the parasympathetically controlled. So it is through your relaxed nervous system, the parasympathetic nervous system. And the parasympathetic cell bodies are the ciliary ganglia. The anterior surface of the midbrain is where the origin of it is. And the superior orbital sockets. That's what I was trying to think from the last slide. Let's go back just so I can. No, don't go that far back. Orbital sockets, right here. Okay, lesions lead to drooping of the upper eyelids, ptosis. I bet that P is silent. It's probably just called ptosis, due to paralysis of the levator, palbrea, and superius muscle. Conditions affecting the oculomotor nerve are diabetes, aneurysm, tumor, trauma, inflammation, and vascular disease. Diabetes affects everything. Oculomotor nerve 3. So you got the superior branch because it's higher, the inferior because it's below the superior, ciliary ganglion, and superior orbital fissure. So the superior orbital fissure is way back in here, towards the edge, posterior part of the orbital sockets. Ciliary ganglion, I guess that's just right behind your eyeball. Trochlear nerve 4. Still has to do with the eyes. So this is the turning downward posterior surface midbrain and innervant superior oblique muscle. Superior orbital fissure. It attaches to the midbrain. The lesion is due to the aneurysm of the internal carotid artery and vascular lesion of the dorsal part of the midbrain. Patient complains of double vision and looking downward. I guess if that's wrong. Trochlear. How can we make that a mnemonic? Troch. I bet if we looked up the Latin origin of the word, it would probably help. So let's do that. Let's see what this stands for. Wikipedia. Pulley-like nerve, trochlear, known as the fourth cranial nerve. Innervates a single muscle, superior, which operates a pulley-like trochlea. Okay, pulley and 4. I don't know, nothing's really jumping out. Somehow relate a pulley to 4. I guess imagine if you're building the pyramids and you're using a pulley system, it takes 4 men to still lift a pyramid. There's 4 sides on the pyramid. Trochlear pulley, that is a reach, but that is the best I can do. The trochlear nerve, yep, we're still on this. So superior orbital fissure, pons, there's the pons. Deep in the brain over there. Trigeminal nerve. Are we recording? We are recording. So it has 3 divisions. Tri is 3. Trigeminal. But also it's the 5th nerve. So you can see how the separations of the face are. This is your ophthalmic zone, basically all the way to the tip of your nose, and then you have your maxillary zone and then your mandibular zone. So like your mandible is your jaw. Everything that moves with your mouth, whenever you open your mouth, that's your mandible. What doesn't move is your maxillary. So that's how the nerves are separated as well. Pretty easy. Ophthalmic nerve, V1. It is a sensory nerve, cornea, skin of forehead, scalp, eyelids, nose, also mucous membrane, and paranasal sinuses and nasal cavity. The origin is the anterior aspect of the pons. It is the opening in the skull. The superior orbital fissure exit the orbit through the supraorbital foramen. And the lesion of this nerve in cornea and conjunctiva will be insensitive to touch. Supraorbital, the frontal, supraorbital, supratrochlear. This is going deep into detail, honestly. Lacrimal, nasal area. So all these are part of the ophthalmic nerve. Trigeminal is 5, ophthalmic is 6. That's really confusing to put V1. So I guess they're trying to put VI. So 6, ophthalmic. How do we relate this to 6? And you can see more of it branching out. It's your ophthalmic division of 5. Trigeminal ganglion, your petrous part of the temporal bone, the fibrous ring of the origin, extraocular muscles, nasillary nerve, ciliary, gangliary, parasympathetic, all that's relaxed nerve, frontal nerve, supraorbital, supratrochlear, anterior epithymidal, infratrochlear, lacrimal nerve, external nasal, and internal nasal branches. Maxillary nerve, its function is the skin of the face over the maxilla, teeth, upper jaw, mucous membrane of nose, maxillary sinus, and origin anterior of the pons. That's awesome. Thanks. Anterior aspect of the pons is the origin of it, and then there's the opening in the skull. The foramen rotunda exits the infraorbital foramen. There's so much to the skull. It's crazy. Like, look at all this. Okay, let's see if we can see what we just read. You can't even tell from this screen. I mean, I can see it on mine. This is supposed to be the nose over here, but I'm not even going to go into detail because you can't, it's just words. Mandible nerve, component, a motor. Muscular mastication, which is chewing. Myeloid, anterior belly of digastric. Tenure, belly, palatine, tympani, tensor tympani. Anterior aspect of the pons is the origin of the mandibular nerve and the foramen ovale. I feel like I wish they went into more details on these, honestly. These are just names and words. Mandibular nerve. Is this 8? Okay. Ophthalmic. And then you have maxillary, that is 7. And then you have mandibular, that is 8. Or is it? Maybe they're just going into the details on these. Okay, so I guess 6 is the abducent nerve. So also has to do with the eyes. We're still in the eyes. Function, lateral rectus muscles turn the eyeball laterally. And the origin is the anterior surface hindbrain between the pons and the medulla. Superior orbital fissure, and the fiber leaves the inferior pons and enter the orbit via superior orbital fissure. The patient can't turn the eyes laterally, and the lesions include damage due to head injuries, cavernous sinus thrombosis, aneurysm of the internal carotid artery, and vascular lesions of the pons. I don't know what a vascular lesion of the pons is. Lesion, let's look up lesion. I'm so thirsty right now. I'm about to have to take a break. Okay, what is a lesion? I know a lesion on the skin, it's like bleeding openings. Any various pathological or traumatic changes in a body organ or tissue, including tumors, ulcers, sores, and wounds. So I guess you could have an ulcer or a sore, and that would be a lesion. Abducent. We're halfway through. Let's take a break.